And heartiest congratulations for the IPO
Thank you.
listing at the Social Stock Exchange. Huge respect for you and the trust.
Thank you. Thank you
And
so
the
much.
wonderful work Guruji is doing for
Yes.
the humanity and the healthcare in India. So, what is the vision and mission at the trust?
Yeah. So the Prashanthi Balamandira Trust and the Sri Madhusudan Sai Global Humanitarian Mission is basically working out of the concept of one world, one family, which is an ancient Indian ethos of Vasudhaiva Kutumbakam, where you see everybody as one world and one family. So, as a public charitable trust, there are many areas, especially in the verticals of health, education, and nutrition, where it has become very unaffordable for people. So, which are actually birthrights of everyone. Everybody deserves it, and everybody needs it. So, affordability should not come in the way. So, as a trust, basically, our service initiatives are focused in these verticals of health, education, and nutrition.
Sure. What is the pressing need of it?
The pressing need of it, well, when you talk of say, let us start with health. So there are millions of people who are pushed into poverty because they are not able to afford medical bills today. A middle class family or a lower middle class family or a family in rural India today is just one medical bill away from poverty. Just one medical bill away, because the affordability is just not there. So what are we going to do about them? How is the rural India going to be serviced in terms of healthcare professionals as well as healthcare infrastructure, where the doctor to patient ratio, the World Health Organization mandates one doctor for every 1,000 patients, but in some parts of rural India it is as bad as one doctor for every 22,000 people. So how is that gap going to be bridged? So that is where the trust started the world's first totally free of charge hospital, which is Sri Madhusudan Sai Institute of Medical Sciences and Research, which was inaugurated by Honorable Prime Minister Modi ji on the year 2023 to build capacity for the country. So that's with regards to health. There are so many children, young children, who are going to school on an empty stomach because their parents are maybe daily wagers, on daily laborers or something, and they just don't have the wherewithal to provide a sumptuous breakfast for the child before they go to school. So that is where our sister trust, the Annapurna Trust, is serving nutritious breakfast to 1 crore children every day in government going schools in rural India. That's with regard to nutrition. Education, we all know the kind of literacy rates. We are a very young nation. The average age is about 28 years of age. So unless we educate them, unless we give them health education and nutrition, we will not be a healthier country, we will not be a literate country, we will not be a healthy nation. So that's the idea.
Right. How can individuals participate in the IPO, and what is the kind of ROI, the intangible ones in terms of lessons?
So once again, Social Stock Exchange is initiative by the National Stock Exchange. While the National Stock Exchange is all about investing through shares and listings and all that in business, where the return on investment depends on how well the share is doing and all that. Here the return on investment is not financial. Here the return on investment is the satisfaction of doing societal good for the society. So individuals, anybody who has a demat account and can just it is a zero coupon and a zero value kind of a offering which is there, they can select that and then do. The advantage of this is that because the NGO is enlisted, registered with the Social Stock Exchange, the NGO has already gone through the rigorous scrutiny and the procedure of being testified, being accountable and credible by the Social Stock Exchange. So one does not have to do any additional due diligence for that. It's a straight away 24 karat gold standard if any NGO is registered with SSC. So as an organization one can do that, as an individual one can do that, and what happens is it gets documented, and this legacy of contribution gets known to the generations also, that my grandfather did that, my father did that, our company did that. So that's the idea.
The beautiful way Guruji also mentioned.
Yes.
So can you share the salient features of the upcoming trauma center?
Yeah. So this trauma center is about 30,000 square feet in square foot area, in built up area. It has 33 emergency beds across 3 different segments. That is, you have red and yellow beds and green beds, with an operation theater as well. State of the art operation theater. It is The infrastructure is also NABH and JCI compliant, which are national and international standards for a very good hospital. So that not just people from the country, but also anyone from outside the country can also come. Today there is a huge need, even in developed countries like UK, where they have like the National Health Service and all that programs like that. But the waiting lines are so huge. So if there is a hospital which is JCI accredited, so they will have the confidence to come and get their service done for elective surgeries as well.
Sure. I believe you have wellness centers as well.
Yes. So while these hospital, what we are talking about, 600-bed hospital, is a place of tertiary care and specialized care, super specialized care. Think of it like a hub and spoke model, where there are a lot of spokes in different districts of the country where people can get preliminary tests done, like a battery of tests, done with regards to blood checkup or basic thyroid tests and all that. And some of these centers will have a specialized center with maybe ultrasound or something like that. And if any anomaly or anything is detected, then they can be referred to our hospital. So in that way, the footfalls in the hospitals are reduced, and also the coverage is taken care. So these wellness centers are called Sai Swasthya, and the idea is to have it in every taluk or in every district of the country. So that would be about 6,000 wellness centers all across the country.
Wonderful. So you also partner with other government agencies and other NGOs?
Yes, of course. Because as a public charitable trust, we are totally dependent on donations. So, corporate social responsibility, the CSR, which the government mandates for companies beyond a particular net worth, beyond a particular income level to do. So, a lot of many of the top corporates of the country do support us with their CSR contributions. We have patrons all over the world who have come, seen the work, and it has struck a chord with them, and they want to be participating as well. And as Sadhguru mentioned, it's a beautiful combination of Sarkar, Sanstha and Samaj.
Yes.
So Sarkar is a government, and without their support and their policy changes, and in fact even their health initiative, insurance schemes like Ayushman Bharat and all that, that's again a good vertical of sustainability for us.
Sure.
Sanstha, people like us who have this thing in the grassroots levels about what needs to be done, and we can deliver. That is important. And then Samaj, of course, with people and companies contributing.
Your final words for the young Indians: how can they participate and be part of the impact and the big story?
Well, today, firstly, by being part of the Social Stock Exchange, the due diligence is done, and the minimum contribution, which was earlier 50,000, has been reduced to 10,000 rupees. And thanks to our Finance Minister Nirmala Sitharamanji's bringing down the tax limits, and 12.75 lakhs, there is no tax for anyone. So that puts a little money back into our kitty in terms of savings on tax, and we all can contribute. 10,000 rupees is not much. We can all contribute, and this will translate into legacy and blessing, which the patients will and all the beneficiaries will be giving to the people who have contributed towards it. So I think that makes it a very, very doable thing.
Yeah, they should open their hearts and donate generously and make a big impact, which is intangible.
Yes,
thank you so much. It was a pleasure talking to you.
Thank you so much.
Huge respect.